how have I been to 6 doctors, taken all these tests, and not a single person, when I say I'm tired,
Mm-hmm.
in my sleep? But you
Crazy.
know what? That's what happens every single day,
Right.
especially women. I feel like a lot of men, if they say they're tired, it's like blood test, sleep test, let's go. For
Mm-hmm.
women, it's
Mm-hmm.
like, oh, it's stress, or you're a mom,
Mm-hmm.
or
Mm-hmm.
We welcome you all to Talk the Talk. My name is Janine Steen,
And I'm Toni-Ann and Dr,
the Masters of Myofunctional Therapy.
Together we interview physicians, dentists, and other professionals to learn how their expertise can benefit you, your child, or your patient's speech and language skills and complement the services they are receiving.
We welcome Dr. Kristen Geist to this episode of Talk the Talk. Dr. Geist is a dentist widely recognized for her holistic approach to oral and overall health. With almost a decade of clinical experience, she has spent the last several years concentrating on airway-focused care, including sleep apnea therapies and adult laser tongue-tie releases. Dr. Geist's passion for this field stems from her own personal journey, which has inspired her to collaborate with other healthcare providers to assist individuals dealing with sleep apnea, tongue-tie issues, and related conditions. I am so excited to have Dr. Geist on this episode. I can't wait to hear more about her own personal journey and how she is helping so many individuals in her own practice. Thank you, Dr. Geist, for joining me.
thank you so much for having me. I'm happy to be here.
So I know we are both in New York. I'm on Long Island. You are upstate. I'm dealing with rain. You're dealing with snow, but we're
Yep.
here this morning. So thank you.
Of course, of
Yeah.
course.
So I would love to start. I know you have your own journey with being diagnosed with sleep apnea and more specifically upper airway resistance syndrome, but I would love to hear more about that and, what brought you upon digging deeper into your sleep and uncovering that diagnosis.
Of course. Yeah. So my story is not unlike a lot of us, I think, in this space. In my experience, a lot of people who start to learn how to treat this stuff, it's because either our kids or ourselves dealt with it. And then once your eyeballs are open to this, it's like you just can't unsee it.
Exactly.
And then like, oh my gosh, wait, there's so much we could do. And like, I wish this had been done for me. So yeah, long story short, when I started as a dentist, I was a couple years out. I was exhausted. I mean, working full time and everything. Of course, you can just be tired as it is, but it was like unreasonably exhausted. And the anxiety was through the roof. My dysregulation was crazy. Like I could cry at the drop of a hat. Like something was wrong. I was very lightheaded and dizzy. I remember having to cancel a patient one time and just like lay in my room because I was like so dizzy. Something was just wrong. And my office is very small. And could walk from my operatory to my front desk and I was like I felt like I had just run. And my assistant would be looking at me like, what is going on? And I'm like, I don't know. And I
Wow.
went to the doctor, actually went to tons of doctors, and it was always the same. Like I got so many tests, blood work, breathing tests, and they were like, oh, you have asthma. And I was like, okay. But all kinds of tests, blood work, whatever, even a chest x-ray.
Wow.
Just-
Yeah.
And they're,
Yeah.
sweetie, is it your stress? That type of thing. Like maybe you
Okay.
should on your stress. And I was like, gosh, am I just like not handling things as well as everybody else? And you start to think like, okay, maybe this is just my normal and I just have to deal with it.
Mm-hmm.
So fast forward a few months later, I happened to go to a sleep course. Thank goodness the universe
Yeah.
didn't.
Right. Yeah.
But I just wanted to visit my sister. And as part of the course, they had people taking sleep tests. They had a group of people who knew they snored or had sleep apnea and a group of people who were like normal sleepers. And I was like, my sleep is fine. I thought my sleep,
Right.
but I don't want to really like screw up my night of sleep at this hotel, but fine. Like I want to learn. So sign me up. I'll do it. So I take the sleep test and the next morning when she prints it out, the tech was like, girl, you like need to see somebody.
Wow.
You are not
Wow.
breathing. And I'm like, what are you talking about? I sleep fine.
Yeah.
I had known I was like a light sleeper, would kind of like toss and turn a lot, but didn't really realize that my breathing could be the cause.
Yeah.
So it really was just this light bulb moment. I was like, how have I been to 6 doctors, taken all these tests, and not a single person, when I say I'm tired,
Mm-hmm.
in my sleep?
Crazy.
But you know what? That's what happens every single day,
Right.
especially women. I feel like a lot of men, if they say they're tired, it's like blood test, sleep test, let's go. For
Mm-hmm.
women, it's like, oh, it's stress or you're a mom or,
Mm-hmm. Mm-hmm.
and so once I finally brought my test results into my pulmonologist and he looked through it and he was like, you know what, this actually makes perfect sense. I'm seeing this more and more now. This was like 8 years ago. So it's
Okay.
come a
Yeah.
and he's like, I'm calling this like the young fit female syndrome. You have these breathing interruptions that are causing your sleep to be fragmented, even though you don't fit the mold of the typical sleep apnea. And he's like, you're a dentist, just make yourself an appliance and see how it goes. And I was like, sir, I don't know what you're talking about. So it just started like a whole rabbit hole of figuring it out on myself.
Yeah.
Because there really wasn't anyone in the area to help me at that time.
Wow.
And once you fall down this rabbit hole, you don't really come back. So here
Mm-hmm.
we are. And now I
Wow.
help with sleep apnea therapies and tongue ties and all that kind of stuff for adults.
Wow, amazing. Yeah. The way the universe can work, getting you at that, conference and hearing those things, or I guess you didn't even hear them and think of yourself, which is,
Oh,
even crazier.
I was like simultaneously like so happy to finally have something to work on.
Yeah.
That's so bad
Yeah.
that how could I have been doing all the right things and been missed?
Mm-hmm.
And if I wasn't so lucky, I would have still been struggling.
What did the journey of treatment look like for you?
So at the beginning, it was a lot of, I did need some inhalers at the beginning there was some sort of spasming going on. And then some home changes, looking at my home, getting rid of any carpeting, any potential allergens that could be causing the breathing issues. A lot of work on good nasal hygiene. I did wear an oral appliance. I still do wear an oral appliance. Myofunctional therapy came along later. We didn't have one in the area when I first went through this. So a few years into it, I was like, ooh, yay, finally. So it's been a whole bunch of things and I'm finally now getting worked up for expansion.
Okay. Are you? Okay.
But my husband just went through double jaw surgery advancement. So he took priority.
Okay. Wow. Okay. Was he his related to sleep as well?
Yeah, he was really
And
severe.
Amber. Yeah. Okay. Did you have to take time like creating your network of referrals in your area and trying to get, because obviously it's not, just the dentist. We have to all work together and it's such a collaborative approach. So were you building that network through yourself in a way?
Yeah, it took a while for us to kind of put the puzzle pieces together. And I was really starting by just like screening my own patients, getting them tested. And then I was feeling frustrated that I could only get so far with traditional therapies like oral appliances. So then once I started to meet myofunctional therapists and I was like, oh, that's another piece of the puzzle. And once I added in like the tongue tie component, or we use the laser for like lifting the soft palate, all these little, oh my gosh, another puzzle piece.
Yeah.
And orthodontists and oral surgeons and just kept adding more over the years. But it did take some time, especially because I was learning, but also because if you throw everything at a patient at one time,
they're like, whoa.
so it's a lot of like, let's start here. Let's get basics, nasal hygiene. Let's get airway a little bit more open and then kind of like build.
Yeah. Yeah. You feel like you play that like quarterback role, right? Of like, okay, one thing at a time. We don't want to overwhelm, especially, I work with a lot of children as well. So telling parents of things like this for their own child can be overwhelming, especially getting that question all the time. How come no one's ever told this to me before? How come the pediatrician didn't say this? Or, it goes on and on. But yeah, there is that nice line of like, okay, there's going to be other providers involved in this treatment, but what's priority and how can we go about this in a way that doesn't feel so overwhelming to the parent or to the patient themselves?
Yeah. And I feel like it's been nice from my perspective as a dentist because I see people so often.
Yeah.
Sometimes I might bring it up. And then it's not till 6 months or a year later or even 2 years later. But there's that thing you recommended for me to look into for my kiddo. Who was it that you recommended? So sometimes it takes a while. And having somebody that you see regularly being like, please look into this has been great because I try to meet people where they're at. And for a while I got frustrated because I'm like, I just want everybody to get help with this. And some people follow through, but that's understandable. Everybody's got a lot going on.
Yeah.
So kind of little bits, anything you can do for people.
Yep. Sometimes you just got to plant those seeds, let them, sit for a second or two. And then when they're ready, it comes back for sure.
You got it.
So tell the listeners a little bit about, you mentioned about the soft palate with the lasers. What kind of treatment is that? Who, might be a candidate for that? What have you noticed with improvements with that procedure?
Yeah. So taking a step back, I mean, people can have obstruction or collapse in several different areas, right? And it's usually more than one. So it might be their nose, it might be the back of their throat, it might be their tongue, might be farther down. So sometimes it's kind of a matter of figuring out between myself and the ENT, like where is collapse happening?
Okay.
And if their soft palate is elongated, by just simply lifting and tightening it, we can make more space for airflow. So the simplest thing I do is I'll take my little headlamp and I'll shine it in my mouth and I'll say, ah, ah, and I'll say, can you see all that blank space back there? And you can see my uvula. A lot of my sleep patients, I see no space.
Yeah.
I see tongue, roof of their mouth,
Mhm.
no space. So the idea is that if we can just lift and tighten that a little bit, make a little bit of space for airflow. I mean, a millimeter in the mouth, a millimeter for air is huge. That's
Yeah.
amazing.
Yeah.
So it's a pretty cool treatment because it's not cutting or bleeding. It's just using laser energy. And it causes that collagen to just contract, which is really, really cool. So there's a variety of lasers that do it. I use the LightScalpel. So LightScalpel users have just a different tip they can use for it, but it only takes a few minutes and it's usually a session or two versus there's night lays out there, which can take like 3 to 5 sessions and usually like 30 or 40 minutes, if I'm not mistaken.
Okay.
So there's different lasers that do the same thing. I just got really lucky that I was already getting LightScalpel
Yeah.
for tongue ties. And then I was like, wow, this is an amazing function of this. How awesome. Because it's a low risk, non-invasive, comfortable thing to try. So it's not something that's going to help every person if that's not where they're collapsing, but it helps a lot of people get us over that little hump. Maybe there's a little residual snoring, that little bit extra we could get beyond their appliance or their orthodontics or whatever they're doing.
Yeah, I've had a few patients go through that and they've described it very similarly, pretty easy and quick, easier than, most dental procedures when it deals with teeth.
Yes. Yeah.
That we all dread.
Exactly. I know. When I talk to people about it, they're like, you want to aim a laser in the back of my throat? What? And I'm like, no, just like, dermatologist lasers all over for wrinkles and hair removal. And
Yeah.
it's a few minutes.
Yeah, I've seen some great results with it. I've seen it really support from a myofunctional perspective too. Like I've seen their treatment be able to, if we kind of hit a plateau and symptoms have kind of improved, but they're not totally gone. And, we've dealt with some other outside things, but they're still maybe have a little bit of daytime fatigue or they're still waking up a little tired and we're doing the myo and then they have that procedure. I feel like it has been like that bit that has gotten them over that hump, which has been really cool to see as well.
That's what I found too. So I never want to say like this is going to cure all your problems, but it's like that adjunct, that extra little bit. And I've had the same thing, people saying even during the day it feels more effortless.
Yeah. And again, I like how you described it because as a speech therapist and myofunctional therapist, we're always looking in the mouth, always doing an intraoral exam. And that's exactly what I'm kind of looking for as well as when I have them open up nice and big, I see what it looks like just at rest. And yeah, exactly that. You're like, can't even see their uvula, or sometimes they'll come to us and say that they gag easily, and that's because that uvula is like touching their tongue because of how long and low that soft palate is, or they'll have swallowing issues because of it. So, and then when they say and you can see like it licks a little, but there's still like none of that black space for them.
Yeah. And you're such an expert with the swallowing, and I found it interesting because after this procedure, I never obviously overpromise anything, but I've had 3 people come back and say, I could never swallow pills before.
Yeah.
It was so hard for me. And they're like, finally, I could swallow a pill. I'm like, makes sense. I never I didn't think much about it because I didn't know that was a problem for them.
Yeah, it's true. Yes, we hear that too. And then, so I know you also do some adult tongue tie releases. Did you get into that during your own airway journey, or was that something you were doing from the start? How did that happen?
So that came about as I learned more. And then as I started to treat so many adults with sleep apnea, and I'm looking in their mouths and I'm like, oh my gosh, wait a second, something's not right here. And I couldn't quite figure out how the tongue was like releasing the tongue was going to help. I felt like it just took a lot more learning to understand when it needs indicated, when it's not, how to go about it, what stage of the process to go about it. So I went into all the like Breathe Institute courses to kind of like start to learn all of that. And then once you start to open your eyes to tongue ties, then you start to see, oh my gosh, so many people just cannot have that simple resting tongue posture. And that is causing so many ripple effects, not just with their sleep. So it came about just more of like a observation and trying to figure out like how is best to address this, and is it safe? Should I not?
Yeah, yeah. And within just your schooling alone, did you learn a lot about screening that, or was that something that you had to go and seek? Because, all the time we'll hear, why didn't the dentist say to us that it seems like a tongue tie? And in my experience, I've said, they don't learn a lot about it in their dental schooling.
We don't. Honestly, it sounds so ridiculous. Like to think about, like we are so comfortable with the mouth and the head and neck anatomy.
Yeah.
We not learn about tongue function, basic tongue function. We really didn't. I feel like unless it was like a very obvious visual to the tip tie, I don't know that we say anything. And even then, it was still that old school, like, but they're speaking okay, versus now I'm like, you see all these other like, but they have neck and jaw tension and they're clenching and grinding and oh my gosh, they're waking up in the night, like, all the ripple effects, the anxiety, all those things. So we really didn't learn it, unfortunately. So there's a lot of work to do here.
Yeah, same. We're dealing with the mouth so much as well. And we hear literally nothing about tongue ties in grad school, nothing about myofunctional therapy. It's something that we have to seek that specialization. But as a dentist, and what would you say is like the best way to go about responding to that question from a parent that says, why didn't my dentist tell me about that? Obviously, it's not to do harm. They don't know what they don't know. And we always want to approach it in a very professional and respectful way. So as a dentist who used to not know and now you do know, how would you hope for other professionals to kind of respond to that question?
No, that's a great point. And I do tiptoe around it in a gentle way because I'll be honest with them. I'll say, I know I missed a lot of things before I knew, because you can't see or diagnose what you don't know, right? So it went right in front of my face, but I didn't realize that it could be problematic or some of the ripple effects or some of the downstream effects. So yes, it may have been there all along, but it's almost like we were kind of blind to it because we weren't aware. So there's just a lack of awareness, and I never put blame on a previous provider. Like I said, I just try to start where we're at. Let's see, what are we looking to improve? Is this realistically going to help that? But I, at this point, don't do any releases unless somebody's been very, very committed to myofunctional therapy. So they usually are pretty informed by the time. It's good.
Yeah. That's how a lot of our providers are in our area. In fact, we collaborate very frequently with Dr. Scott Siegel, who's, wonderful and very world-renowned. And they, don't even see them. They pick up the phone and they say, I think I have a tongue tie. And one of their first questions are, did you do any myofunctional therapy? No. Okay, we want you to go here first. And then they'll let us know when you're ready to come see us, which, is so respectful. I feel that they're not turning away patients, but they're making sure everything's being done correctly, which is so important for the success of the tongue tie procedure.
100%. I mean, anybody can release a tongue, but I feel like if we don't do that pre-op work, it's not going to heal as well. The tongue won't know what to do, how to properly swallow, where to go. You don't have that tone, and it's just kind of like wobbling back and forth. We all learn as we go, and I've learned it's just not worth it.
Yeah. I always try to explain, I feel like to the patient, it makes sense to think that the tongue tie is the answer, the release is the answer. I get why they would think that, but I take time to kind of educate them that it's really just a piece of the puzzle. I wish it was that magic pill procedure and everything was going to function great right after, but our bodies have muscle memory, and our bodies, are going to keep doing what they're doing. The tongue's going to keep resting low, or the mouth is still going to be open, or you'll still have that tongue thrust swallow even after the release. We have to now teach the tongue and train the muscles. We might not have been able to do that without the release, but it's all, pieces to the puzzle.
Yeah, especially with the adults that I see. I mean, it's like 30, 40 years of their life that we're
Yeah.
trying to create habits.
Uh-huh.
So much.
Yes, I know. And then they're like, so will we need like maybe 2 sessions? I'm like, oh, I'm so sorry, but no, we're going to need a lot more than that to undo, the 45 years of what you've been doing. But it's possible. So that's the good news.
Yeah.
So now, obviously, I know you've done a lot of work on yourself. You still have treatment that you mentioned. You're, being evaluated for adult palatal expansion. What did you notice has changed so far? And do you feel, I know I say it, and a lot of other professionals say it, you sometimes don't realize how atypical things are until you start feeling the typical. You don't realize how bad it maybe was until you start feeling the difference. Did you experience that?
Yeah, absolutely. I feel like I was so I mean, I think I've had this my whole life. I
Mm-hmm.
was a child grinding my teeth so loud that my parents could hear it from the other room.
Okay.
Now, oh my gosh, let's
Hmm.
help the child breathe. But we didn't know that then.
Yeah.
Even my father is a dentist with a pediatrician that we saw about it. They were kind of like, I don't know, I think she'll grow out of it. And I don't blame
Mhm.
them because there wasn't the awareness.
Yeah.
But now I know, I think I've just kind of had it forever. So you just adapt to what is your normal.
Mhm.
But as I've kind of added these puzzle pieces for myself, more restful sleep for sure. I don't wake up as much. I'm not tossing and turning as much.
Okay.
Headaches was a huge one. I was getting headaches like many times a week. And that's like very rare now, maybe once a month. So that's been amazing. The anxiety is like, I feel like just a
Hmm.
calm
Oh.
human. The tooth grinding, clenching. I mean, I think I just purely wasn't breathing. So the jaw
Hmm.
clenching, all of
Hmm.
that. It's
Hmm.
been a lot of ripple effects
Wow.
in the positive direction.
Yeah, sounds like, I mean, just the daily changes. It's life changing, to be able to wake up and feel better and not have the weight on your shoulders of that anxiety or anxious feeling. So it sounds like it probably has been life changing for you.
Absolutely. I mean, I'm on no medications. I'm
Yeah.
just sleeping.
Yeah. Sleeping well, right? So many
Yeah,
times, parents will say or patients will say, I get, 8 hours of sleep. I don't understand. It can't be my sleep. I sleep for 8 hours and, I sleep great. But they don't realize that if that mouth is open or the child's mouth is open and they're mouth breathing for that whole 8 hours, quantity doesn't always equal quality.
exactly. And we don't
Hmm.
realize how disrupted we are because like your brain
Hmm.
is activating, but you may not remember that you woke up
Right,
all the
right. Yeah.
time.
Definitely. Yeah, all the time. And, parents will be like, I think they sleep great. They don't come in my room. So I'm like, well, that's fabulous for everybody. But, sometimes they don't even know a lot of the things because the child doesn't wake up and go in their room. So they'll say, I don't think they're restless, or I don't think they sleep with their mouth open because they stay in their room all night. And for those patients, a lot of the times I tell the parents, like, let's just try to peek on them for like the next week and see what's going on. And then they'll be like, oh my gosh, he's, all over the bed and his mouth is open and he's sleeping in all these crazy positions. He was grinding his teeth for a moment, but they don't realize it because it's great. The child stays in their bed all night, but, things can still be happening there.
Absolutely.
Yeah.
Yeah.
So I know that, you kind of touched on it with yourself, but I think it's important to kind of go back to it a little bit. Is that I forget what you said your doctor called it, but how
Yep.
women,
The female.
yeah, it is. We see it all the time. Like, or people associate sleep apnea with being overweight or being obese. And what are you seeing in a lot of your female patients and even male patients that don't, fit that standard, what you think a sleep apnea patient looks like? What are some things that listeners right now could be looking for in themselves that might not be those really classic sleep signs?
So there's definitely a huge difference in how men present versus how women present. Type even aside, to be
Mm-hmm.
honest. So much about our anatomy and the
Mm-hmm.
collapsibility. Yes, weight can sometimes play a role, but we'd be surprised to see how many it doesn't play a role for.
Mm-hmm.
So men tend to come in with the snoring, the tiredness, the feeling like they need to take a nap all the time. And it's usually like somebody has bugged them to get the snoring taken care of. And the women, it tends to be more of an issue of headaches, jaw pain. they tend to come to me for the jaw pain,
Okay.
for the TMJ issues. And then as we kind of go through the screening, I'm like, oh my gosh, I think you're possibly needing a little support with your breathing. And once you get your breathing better, the jaw will kind of relax because it doesn't need to work so hard. So women tend to present more with TMJ issues, jaw pain, headaches, more of a fatigue. They describe it as more of like a brain foggy and a fatigue sort of feeling, anxiety. And I would say both men and women, a lot of acid reflux and a lot of high blood pressure, all of those things. And acid reflux is a big, big one that I feel like gets passed over a lot.
Wow.
And from your perspective with the swallow and everything, it makes a lot of sense, right? Like if you can't create that good swallow, things might get pulled back up. But also just when you're sleeping, when your body tries to react and gasp, right, to get that breath, it's an upward vacuum all night long. How many times an hour that you're upward bringing acid into your mouth. So I would start to notice in people like, why do they have all this acid erosion on their teeth? Because as we can tell the difference between when it's acid versus pressure.
Wow.
Like, do you sleep on your right side? Because I'll be like, you have all this acid erosion all on just your right teeth. Like, what's going on here? So sometimes it's a variety of different signs that we see dentally and medical history wise that we kind of have to put together, but it definitely does present differently in men and women.
Okay.
There was a study, I'm trying to remember the exact fact. I think it's like 40% of women who have like moderate sleep apnea don't have the typical signs. Just crazy. So they're going to the doctor and they're just being told, you're fine. You're probably a little tired because you're a mom.
Right.
Because those little other signs didn't signal their PCP or whoever to get them a sleep test. So the AHI and the typical scores that we look at for sleep apnea are really more geared towards diagnosing men.
Okay. Yeah. I was going to ask you about that because I have heard other professionals talk about how UARS is oftentimes missed on sleep studies. So is there something they need to say going into the sleep study? Is there a certain type of doctor that needs to read the sleep study? What would be some of your thoughts there?
So it's important to know that a home sleep test, if anything, tends to underestimate. So if you're getting a score in a sleep test that's like borderline, you probably have something going on. But a home sleep test can rule in sleep apnea very, very well. It cannot rule it out.
Okay.
If you have all these symptoms and your home sleep test is normal, you keep digging. That's where you get your NT evaluation. Maybe you do get an in-lab test. It's not that often that we need to do it, but it can happen. So it's not where you stop if a home sleep test comes back, quote unquote, normal. Seeing is a lot of women coming to me for a second opinion because their sleep apnea score, their AHI, was very low, 1, 2. So their doctor said they were fine. And then I look at the test, their RDI was high, which is a score that includes not just their apneas and hypopneas. I can explain that in a second. It includes the other little respiratory effort arousals. So these other little things that didn't quite count enough, but it woke up and it fragmented the sleep. So the UARS people tend to have a high RDI, which now some doctors are recognizing for diagnosis.
Okay.
The problem with UARS is more of the fragmentation of sleep. They're not having those oxygen drops. They're not necessarily having those apneas. So it doesn't get caught, or because it's not bad enough each individual episode, but they're getting fragmented way more.
Okay.
Because the way I explain it is like a faucet. So if I have a faucet turned on, the water's going through, that's normal breathing. If I turn it off, that's an apnea, right? Nothing's really coming through. That's your oxygen drop. If I have it on, drip, 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 little bits coming through, that's hypopneas. That's usually what's happening to UARS people all night long.
Wow.
So it's enough of a stress on your system because everything just takes more effort. More effort to breathe. Your oxygen's kind of staying okay, but it puts you in that like upregulated sympathetic fight or flight mode all night long. So you wake up with a headache and high anxiety and just feeling like junk because you just had this like really annoying fragmented sleep all night long and never really got in those deeper states of sleep. So it makes sense why you can't remember things because you didn't have that stage of sleep for very long.
Wow. Yeah. Do you find that I know you talked about like a lot of the times it being pushed on to like you're a mom, you're tired, you're a working mom on top of that. Do you find that sometimes they're being told too it has to do with like menopause, perimenopause? Is that sometimes that crutch that they blame things on as well?
Absolutely. And the frustrating part to me is a sleep test, especially a home sleep test, is so
Mhm.
easy. It's non-invasive. They're not very expensive anymore.
Okay.
So why wouldn't we just do one to rule
Mm-hmm.
it out? Kind of like
Mm-hmm.
everyone gets colonoscopy. Everybody
Yeah.
should get a sleep test every
Yeah.
like years. It doesn't make sense to me because they're really not that like complicated. They've come so far.
Mm-hmm.
So in my opinion, it should be just a standard screening that everybody gets. But menopause can make a big change. I have people who have been fine for years
Mm-hmm.
and then they start to snore. And sometimes it's because that soft palate relaxed because of
Mm-hmm.
changes. Sometimes it's simple things. And it might not be enough to get them sleep apnea therapy, but we could still do things to help them sleep better, breathe better through
Mm-hmm.
myofunctional therapy and some of those other adjuncts.
Yeah. Does a CPAP machine work for upper airway resistance syndrome, or is that like not as effective for those patients?
So it's going to work. I've had a lot of trouble with compliance, not because people aren't trying, but because a lot
Mm-hmm.
of the women I see are young moms
Mm-hmm. Yeah.
breastfeeding, and they're like, I
Mm-hmm.
can't take something on and off my face
Mm-hmm.
constantly. This is just not going to work in this season of my life. And I'm like, girl, I get it. I
Yeah. Yeah.
completely get it.
Oh.
So it absolutely can work, but sometimes it just doesn't work in that season of life, depending on where you're at. Um,
Mm-hmm.
that's where we tend to say maybe we try an appliance for a chunk of time, and then we down the road look into something like changing the structure through orthodontics or surgery or do a CPAP. But there's always going to be what's working for them in
Mm-hmm.
this season of their life.
Yeah. Do you feel like the CPAP is sometimes necessary in that moment as like kind of almost like a band-aid of a situation, but trying to dig through the layers to figure out, well, why do you need the CPAP? Let's get to the why, the root cause, and hopefully we can resolve that and not need to rely on something like a CPAP.
Absolutely. Yeah. I always like to get people to a point where they don't need a whole bunch of crutches. Uh,
Mm-hmm.
that would be the ideal
Mm-hmm.
situation. But yeah, the reverse is true too. Sometimes it's like I can't get coverage for whatever other therapy, but my insurance will cover a CPAP. I'm like, amazing. Try
Mm-hmm.
it. Let's
Yeah.
see how you feel. Let's get you through for a while. And sometimes,
Mm-hmm.
a lot of times people do great with it. And I'm
Yeah.
never encourage it if somebody's doing well with it, but I just
Mm-hmm.
say, hey, I'm here. If it's not working, we have lots of alternatives and,
Mm-hmm.
point you in the right direction.
Yeah, which I feel like we used to not have other alternatives, right? It used to be CPAP or nothing. And if you can't tolerate it, we have a lot of patients who can't tolerate it from like I feel like I'm choking, I feel like I'm gagging. And maybe that has something to do with that soft palate. But we also see that doing myofunctional therapy has helped them to be able to tolerate a CPAP too, because we're getting that tongue up and out of the way and letting that machine do what it needs to do.
Yeah, so sometimes we can get the CPAP more comfortable through doing myo, uh,
Hmm.
dealing with the tongue and all of that because we can get the pressure down lower. And sometimes it's like too much, just too much pressure. So there's different
Hmm.
combination therapies, which when you find good providers who can work with you and
Hmm.
make those tweaks, it's not a big deal. But I think sometimes people are just kind of handed a CPAP and then like that's it.
Yeah, right. There's no direction, no like here, go home, read the
Yeah.
manual, good luck.
Yeah.
Yeah, and it's a lot, especially when you are like you said, a mom, young children, you're trying to get them to bed. You come last for how many years of your life a lot of the times. So, how about we just talk a little bit about what's left for your journey? What is your time frame looking like, and how did you know you were going to be in need of adult palatal expansion and all of that good stuff?
So I guess the more I learned, and the more I realized like this is only gonna likely get worse as we age, right? Things only
Hmm.
get more flabby and collapsible as we
Yeah,
age.
yeah.
So as much work as I've done on like nasal hygiene and all of this, and I had been to an ENT and they were kind of like, there's not much that we can do that's gonna make a huge difference for you. I kind of felt like this was the only way for me to potentially go through the rest of my life without a crutch.
Hmm.
So I, did a CBCT with my oral surgeon, and he was like, "Do you want to do jaw surgery?" And I'm like, "Can we try expansion first?" And then
Yeah.
think about it. So it's kind of more of at this point. what makes sense for me. If I can do this, could I potentially not need a crutch
Mm-hmm.
for that's the idea.
Mm-hmm.
Because I'm, 36, I want to get to a point where I can sleep without needing a whole bunch of stuff to keep my airway open.
Mm-hmm. Yeah, definitely. Yeah, that's great. And you'll do like is it the Mark-B that you'll be doing? Yeah. Okay. Do you want to describe that a little bit for any of the listeners?
Sure. So we hear about kids getting expansion all the time, and I had braces for like 4 years, but I didn't have expansion. I didn't know any better. We didn't know any better. And even now, like when I took my intermolar width, I was like shocked because I didn't realize how narrow that I was. Because I was
Mhm.
like, I think things are fine.
Yeah.
But I think we didn't have that baseline knowledge of, oh my gosh, the roof of my mouth is the floor of my nose. And if the
Mhm.
roof of your mouth is nice and broad and flat,
Mhm.
you can breathe so nicely through your nose. But if it's
Mhm.
all kinked up and vaulted, you have a hard time breathing through your nose. And I was kind of
Mhm.
like, this makes a lot of sense because I've always struggled with nasal breathing and I have to do so many things.
Mhm.
So yeah, that's the plan, is to do a little bit of expansion first to get that a little wider and then use orthodontics to bring the teeth kind of back
Mhm.
into alignment.
Mhm.
For
Mhm.
that, I looked into, of course, all the options. There's Vivos and there's different things out there for expansion. I personally didn't know that I wanted to do something removable,
Okay.
more of just personal preference. A, I don't have a provider right here that I wanted to work with. And B, I just felt like if I took it out or I could take it out, I don't know that I would wear it enough.
Yeah.
You know what I mean? Just like, I'm like, if I'm going to do this, I want it
Yeah.
like there. It's
Mhm.
moving. So that was my
Mhm.
train of thought. But people do really well with Vivos in other areas.
Yeah, it's funny you say that. I'm going through right now my own orthodontics, and I did lingual braces. So I have the inside braces on the top and
Yep.
bottom. And I did it with a very airway focused orthodontist in my area, and I did the CPCT scan, and I did the whole assessment, and I went into it thinking for sure I was going to be doing expansion because I am pretty narrow, but I don't have any symptoms. So like I don't have anything that goes along with it. My only thing was that my hygienist would always say, like, your teeth are so tight that it's not great from like a hygiene perspective. So I'd go for my cleanings every 3 months instead of 6 months and just like try to stay on top of it. So it's like, you know what? If she's seeing it from that perspective, maybe there's more. Maybe there's things that I don't know that I'm not like picking up on. So I did do the full assessment, but he said, your airway is more than average. I'm not surprised that you don't have symptoms because your nasal passage, your airway, everything looks great. So he said, for me, we can do Invisalign. I can get a broader smile that's going to give you more spacing between the dentition, more tongue space. You're not going to get structural changes, but you'll get more tongue space because we're going to kind of tip those teeth a bit, which I liked because I'm like, okay, I know all about tongue space and how important that is. Or we could do lingual braces and they'd be on, the backs of your teeth. So I did go with this option because I knew it. If I was in Invisalign, I would not be compliant.
I know, and I think that's an important
Yeah,
consideration. Because yes, it's so tempting, but the reality is then you're going to spend all this time and money and nothing's
yeah.
going to change, and then you'll just be frustrated.
Yeah, I know. It's funny, and especially in this, profession. I'm like eating between patients, and then like with these, I just eat, and obviously I have to be good with the hygiene side, but it's just easier. It does affect my speech, which is not great as a speech pathologist, but
Really well, I couldn't even tell.
oh, I'm glad to hear that. I hear it all the time. That's what he
Yeah.
tells me. He's like, you hear it more. I'm like, I hear it. But, it has been more effective than Invisalign. Like he had told me from the start that he would be able to get better, quicker results. And they're really cool. I don't know if you're familiar with them, but the wire is custom to the movement that my teeth need. So he explained it like the wire will uncoil as I'm going. So like I just went last month. Yeah, I went in February. I don't have to go back till May. So you don't really go often. I got them in November and I already see like huge changes when I'm flossing. I'm like, oh, this is what it's supposed to feel like when you floss, not like trying to jam the floss up there. So it's been good though.
That's awesome.
Yeah. So last thing that we'll go through, I know I saw on, I believe your social media, your Instagram, are you planning some type of fall retreat? Is that right that I saw something like that?
Yeah, so we did our first one last year, my co-host Shivani and myself. We wanted to create a space for women. For now, it's women in dentistry, women dentists. We did have a
Yeah.
hygienist last year
Oh,
who are looking for a foundation, who are looking for how to learn how to implement screening. It doesn't need to be hard, like how to have those conversations in your practice. There's no pressure to treat, but there is a foundation of like the basics, oral appliance therapy, how to collaborate, how to refer, how to find your network of people. So it's 12 CE credits for dentists or hygienists, but it's also a wellness retreat. It's at this
wow.
beautiful location in the Catskills, actually. So
Okay.
you
Yeah. Mm-hmm.
and so it's a very non-traditional CE weekend because we'll do like yoga and breath work. And then we'll take some like a class in this beautiful greenhouse instead of in like a conference room. We'll go hang outside or go to the sauna or whatever. So it's very non-traditional, but we had so much fun last year. And the women who took it are now like really branching out into like more and more and more learning, which is really encouraging. So our point is to just kind of get more dentists and hygienists screening and hopefully get this awareness out there a little bit more.
It sounds amazing. The pictures looked beautiful. The Catskills is one of my favorite places. So I would love to pass this along to obviously dentists in my area or any hygienists. Where can we go to find out more about that or to register?
If you follow me on Instagram at Prana with Dr. Kristen, I share about it on there. I think we have another week left of an early bird discount. There's $500 off still. But if you're a business owner, it's all a write-off. So keep that in
Yeah.
mind. A lot of continuing education. So there's details on there and I'll continue to share about it there. But for women or for any dentists in general who want to learn more but can't commit to a retreat, I do some small group coaching just to get people going on this because I think it's kind of a lonely road sometimes when you're trying to figure this out and just figure out the logistics of how to do this in your busy everyday practice. And sometimes in the big Facebook groups, like the big dental ones, you come in there with a question and people just kind of like attack you. So we have created like a safe space of a small group of women who are starting this, like, hey, here's this case. What do you think? Where should I go next? So that's my goal is just get people started and create a safe space.
That's great. Yeah. And it's always nice. We go to a lot of conferences. I am part of SpotPal, which is like a tongue training tool. And it's very airway related. And we go to a ton of conferences. And it's always nice to hear people like, it's just so empowering to be surrounded by people because I do feel like I'm on my own isolated island in my area. And then you come here and it's like, some of the smaller conferences, 500 people, some of the bigger conferences, you could be surrounded by thousands of other people that are saying the same thing and treating the same way as you. And that is so, so powerful, I think.
Yeah, agreed.
Yeah. Well, wonderful. What are the dates of that retreat for anybody listening?
October 1st through the 4th.
Okay.
So it's weekend.
Okay, cool. I can't wait to see how that goes and see some of the pictures and fun of that as well.
Yeah, we have a myofunctional therapist coming to speak.
Yeah.
So there's a good intro because it's amazing how many dentists don't even really know what myo is. Like seeing those signs of like, but when do we refer?
Yeah, what can we see? What can we look for? That's great. That's wonderful. Yay. Well, thank you so much for joining me today and being a guest on our podcast. It was so wonderful to have you, and I can't wait for the listeners to be able to get access to this episode.
So much. I appreciate it.
Thank you for joining us on this episode of Talk the Talk.
We hope it was enjoyable and educational and further supports you both personally and professionally.
For more information, please check out our Wyo Myo and Myo Minute podcast, as well as our other episodes of Talk the Talk. And don't forget to check out our tongue training appliance, SpotPal, to help with tongue thrusting, thumb sucking, snoring, TMJ, mouth breathing, and so much more. Visit thespotpal.com.